It's really good to see everybody joining our chat today and our virtual town hall meeting. Uh, I'm Keith Inman. I have the honor and really privilege to be the president of Kosair Charities. And, there's a couple of things that I think about every day. And one is a quote from Walt Disney that says, if you can dream it, you can do it. And we dream of a world where all kids can grow up happy, healthy, and safe. So we know that we're going to be able to do that. I'm excited to be at our virtual town hall. Technology at its best, and live internet. It doesn't get any better than this. So we're still trying to figure it out here too. So bear with us. There might be a hiccup or two, or we might stutter or mispronounce a word, but we're just excited to be here, and we have a lot to share with you today. What are we here for today? And we're really here to give you, the donor, the confidence that your gifts are making a difference. And we're just here to share some stories and about our work. So, what are we going to do today? Well, first of all, in a couple of seconds, I'm going to introduce our panel and our speakers. I think you're going to find them to be very engaging and very high quality. I want to share with you the history of Kosair. In our history over 97 years, and kind of where we've come from and where we are today. I want to give you stories and information about the gifts you've helped, and we want to look towards the future and discuss the problems we want to fix. We want to really dive into the issues that affect kids and what we can do to fix them, because we want every child in our community, in our region and state, to grow up happy, healthy, and safe. And it's really up to our donors that have led the way, for all of our 97 years. So, and then obviously we're going to leave time for questions and answers. So now I'd like to introduce to you, obviously, you've met me, but I want to introduce Megan Meredith. She's our Assistant Vice President for Community Impact. And Megan's key job is she is the head lead of our grants process. She's been with the organization several years and just does a great job. And somebody newer to the team is Allison Ferry, Director of Community Impact. And Allison brings a lot of passion and a lot of enthusiasm to the organization. And between the two of them, and they let me tag along every now and then, they work day in and day out with our grantees, and not only helping us understand what they're trying to accomplish, but helping the grantees understand what we're trying to accomplish. And I'm going to turn it over to Megan for a few minutes, and she's going to take the next part.
So thank you all so much for being here and kind of learning more about what we are doing and what we're trying to do. And really, we want your participation in this virtual town hall. You can ask questions in the chat. We have somebody that's going to kind of flow through them and get them to us if we can answer them. And if not, we will get back to you. But we really want you all to engage with us so we can kind of have a conversation and just really get to know each other and talk about what we're doing and what you want to accomplish with your donations and how we can help you do that. So just like we would with any kind of meeting, pretend we're all together and we're just having a conversation and we're going through everything. You again can send a message in the chat box, or you can raise your hand and we will have somebody kind of get a hold of you and see what questions you have or what you need. And then at the very end, we will do just a general question and answer session. We'll probably stack up all the questions and wait till the end of this presentation and go through everything and see how we can help. So again, chat, raise your hand, and then we'll get it all in the Q&A section at the end. We would love participation, so please participate if you can. And we'll go back.
And throughout the day, we're going to have some poll questions. We'd love to have your feedback, so be looking for those. And in history, when do we start awarding grants and why? But to understand that, I think you have to understand the history of Kosair Charities. And, for over 97 years, Kosair Charities, its board, staff, and really donors have had one mission. And that mission is to help our children, the children of our community, state, and region, overcome significant obstacles and reach their full potential. And it all started back in 1923, where we acquired this property. In fact, our offices are still in the same place. It's that Tudor style. That's a huge Tudor style campus there on Eastern Parkway. And from 1923 to 1981, we were a provider. We were a hospital. We opened up as Kosair Crippled Children's Hospital, and we dealt with a lot of birth defects and orthopedic issues and infections and polio. And a little bit later on, we'll probably talk a little bit about, or maybe a whole lot about, what we consider to be today's polio. But, we wrestled with a lot. And then we consolidated with Children's Hospital, and they had a more of an efficient model. So at that point in 82, we started looking at how we could help the community. In the early days after 82, we still were a major funder of hospitals, especially in Louisville. And we started branching out to other organizations. And then about 20 years ago, this seems like yesterday because I remember this, when the Home of the Innocents was needing to move to provide more services. They were located in a small building at Gray Street down behind the U of L Medical School. And they were wanting to move to the stockyards where they are now. And as things happen in the fundraising world, sometimes things snags, and they were having some issues getting over the hump. So they came to Kosair. Kosair provided the funding to buy the property, at least most of it, and made a long-term grant to the Home of the Innocents. And now they're a wonderful organization, always have been, but they have a wonderful facility, and they really, really are a key to Louisville. And they're really one of those organizations that makes Louisville. But but that gave Kosair Charities and the board at the time the real confidence and that there was more to do, that there was more to do in the community. So from that point in 82 and then into 2000 with the Home of the Innocents, and even now, we'll provide millions of dollars a year to Southern Indiana and Louisville and across the state to help kids reach their full potential. In any given year, we'll have about 180 requests, and for somewhere about $35 million worth of need. Unfortunately, we can't fund all of them, but we do fund somewhere between 12 and 15, 16 million dollars a year, based on a lot of things. One is the amount of donations we receive, and how the market's doing. So again, when we think about our history, it's colorful, and we've come a long way. And Megan, let me throw it back to you guys.
And this is just a real quick picture, an actual photograph from this Kosair Crippled Children's Hospital way back when they were working with the kids here on the campus. And then this is a picture now, which is one of our Kosair kids in both our financial assistance programs, attending one of our partner organizations that works in therapy. So it's amazing what we were able to do back then, and it's wonderful what we are able to do now. So what makes us different? And it's a lot of things. We don't provide any direct services, but we have the people in the community. We have very strong ties with the people in the community that do. And as Keith said, my job and Allison's job is to just be in the community constantly, talking with nonprofits, talking with experts, talking with researchers and leaders in fields, and figuring out what is happening right now. What are the advances? Who is doing things well, and where we need to put our funds for the biggest impact. And that is solely our job. So in a way, we can kind of take funds and put them to the best places possible. And we can pivot easily. With last year with COVID, we saw that a lot of our partner organizations were struggling with just keeping the doors open and making sure that the kids had somewhere to come back to. So we were able to step in and help immediately. We pivoted so quickly, and we got to these organizations and we're just, what do you need from us? What can we do? And we were able to help a lot of organizations get through this. And that is something that is just absolutely wonderful, and something that I am so proud to say that Kosair Charities can step up and do for our community. But we have a Kosair Kids Financial Assistance Program also. So we take funds and we help families pay medical bills that otherwise wouldn't be able to pay for them. And that is something that is very unique to us. I don't know of any other organizations that are able to do that. And we make sure that kids get the medical care that they need in Kentucky and Southern Indiana. We spread that all across Kentucky and into Southern Indiana. So we have a good relationship with also medical vendors around the area. And we want to make sure that children are receiving everything that they need with healthcare and resources and equipment. And we are very big into therapy and hearing aids. And it's just very wonderful to also be able to do that as well. So I'll turn it to Allison, and she can talk about our areas of highest need and what we are focusing on.
Sure. So we'll be diving into more detail about the different areas of highest need, but as you can see here, all of the counties that are the programs that we fund reach families in all of these different counties. So I believe we might have a question for you, a polling question for you. Oh no, we're going to go into the research. Sorry, we're clearly learning this as well. So looking at the programs that we fund, as Megan mentioned, our ability to pivot for where the need is, we fund programs in research, healthcare, education, social services, and child advocacy. And we have one story about this special child right here that Megan's going to tell you about.
We have our poll question first. Sorry, we are learning. So for our first poll question, you helped change children's lives in a number of ways. Are any of these focus areas surprising or new to you? So we work in all different areas, not just healthcare. And that is something that we are trying to make sure that our donors and our public know about us, that we are spreading our services and our funds across all different issues in the state. So we'll give you about 30 seconds to go ahead and answer this, and then just kind of go through what you all found were surprising to you.
And Megan, as we go, and if we could go back to that areas of highest needs slide.
Yes, absolutely.
And then I'll move right into Logan.
Okay.
Okay.
I think we will wait till everybody answers, and then I'll move back. Pediatric research, overwhelming number of that was surprising. And that is actually something that we are very invested in. And it's both research for different kinds of therapies, research in cancer, research for pediatric forensics, and then education came in second, which is also something that's a little bit newer to Kosair Charities. We saw the need to kind of get into the education realm and make sure that kids were receiving the education that they needed to succeed. So that is something that has happened in about the last decade.
Megan, you can leave that slide up, and let me talk about those areas too, because I want to add to something that Allison set up. And when we think about research, we're thinking about solving the medical mysteries that impact our children. We're very heavily invested in cancer. Mm-hmm. We're very heavily invested in spinal cord and neuro work, which we're going to talk in a second, the rehab of that. And in healthcare, again, we're very focused on, we want to make sure that folks have access to healthcare. We are a major funder of neonatal ICUs throughout the state because we want our kids to grow up, to have a good start in life. And we also want to make sure that when there are births that require a neonatal ICU, that they can stay close to home. Mm-hmm. So that we're very focused on that, but access. And then, education is as Megan said, is fairly new for us. We've always been focused on education where it's that special needs child, the child that learns differently. We've always been there, but right now with COVID, we're concerned about what does that mean? Because I kind of walk around thinking that right now with what's going on in the world, all of our children in Kentucky and Southern Indiana are special needs by definition with the world's going on. Social services, again, that infrastructure, everything from food to transportation to just wrap around, making sure that family's taken care of and they can negotiate the myriad of services that are there for a child that has some specialized needs. And then child advocacy, and most importantly, what this speaks to us is, it's an adult's responsibility to protect our children. And we want to make sure that from the state level to the city level, that the policies are in place to protect our children. We lead the country in the incidence of child abuse and neglect, and that's a stat that we don't like. And we're very focused on ending that. So that's a major piece of ours. So I just wanted to kind of give some a little bit more depth to the areas and why that we're focused on it.
And we had a quick question that we can address while we're on this slide. To clarify, if that didn't help clarify already, the question was asking if our research funding is specifically for healthcare or if it's for other forms of research as well. And so the research funding that we specified is for pediatric healthcare research that Keith just elaborated on, while Megan and I do ensure that we have the research that we need for the other various areas. It's not necessarily the part of research that we fund.
Yeah, we've, one of our great programs, the FACE IT program, we fund some physicians at Dr. Curry at the University of Louisville and Dr. Howard at the University of Kentucky. And in their research, they've been able to look at injuries to children, and they've done enough research where they can tell that if an injury is just a routine bruise that any kid could get, or if this injury was definitely caused by abuse. So it's you wouldn't think of that as research, but that's a very important piece of research. So I hope that answered that question.
Mm-hmm. If we want to go on, I think we have a nice video that we can show you.
Yeah, and this is one of the patients. I talked about pediatric neuro recovery and neuro rehab. This is Logan. Logan came to us from New York, and about 7 years ago, Kosair Charities made the largest pediatric rehab grant made in the country ever. And it was focused on trying to help the children that had spinal cord injuries, deal with it. And while we don't have kids walking yet, it's very promising that we could. But if you see throughout this video, Logan is challenged. He can't sit up without a brace or without being held. Had movement issues, and through the work being done by Dr. Behrman and her great staff at the university, Logan is able to sit up. He's able to use his trunk muscles. He's able to use his arms more. And the other thing that these kids, they have bowel and bladder issues. So he has bowel and bladder control now. He also has a better time regulating his temperature. So, he can go outside or, at various times of the year when it's either too hot or too cold, he's safe to go out there. And he's gaining muscle control, and his legs, his legs have definition, and we're seeing that over and over and over with this population. And typically you'd see a child in a wheelchair or a person, you say, man, I'm glad that's not me, or you say, boy, that's too bad. Well, we're giving through our support and through this program at the University of Louisville and Dr. Behrman, these kids are regaining health. They have opportunities ahead of them, and it's really heartwarming to see what's going down there. And I'll be honest with you, I'm an old softie. I'll shed a tear when they open a Kroger's, but when I go down to see these kids, it's emotional. And I'm proud every day that we can help this population. There are people from all over the country moving to Louisville for this program. But we're seeing that for other programs that we support too. We're seeing people come into our community because we have some of the best programs focused on helping kids around. Our Face It program with on child abuse, we have organizations from other states calling us, asking how to replicate it. We have countries calling us. We have countries calling us saying, how can we replicate your abuse program in our country? So again, that's just to say that your gifts make a difference, and your gifts not only make a difference here, that, it's given us the knowledge to help other states and locations make it too. So.
To add on to that, Dr. Behrman's work at U of L is very intense. Most of those kids are there 5 days a week for hours at a time, because she is just leading the way with new therapies and making sure that those kids can get back to some sort of normalcy in their life. So we have worked with U of L and Ronald McDonald House. So as Logan came from New York, a lot of these families are coming from all over the country, and they're either moving here or they need somewhere to stay here temporarily while they go through this intense therapy. And Ronald McDonald has now a Kosair Charities floor for those kids who are in this program, and the families can stay. It is completely handicap accessible. The rooms that we got to tour it way back when we could tour things, and the rooms are handicap accessible. They are given all the food that they need for the time, and it's an easy transport to the hospital. So they don't have to have that concern. They don't have to worry about, where am I going to be when I get to Louisville so I can get my child in this therapy? It's completely taken care of. And we are working towards making sure that, anybody who needs that therapy, there are no barriers to get to it. And that's just another wonderful thing that we get to say that we do. We're making sure that people are working together and we can help families with the full spectrum of healthcare, and anything that they need, we are going to be able to help them with. Next slide. So how does this work in the process of choosing the best organizations for your funds? So our application process has evolved over the last few years. This is our first year. We have started with a letter of intent, and nonprofits around the area, any nonprofit that serves children is able to submit a letter of intent. And this was open in December, and they were given a few weeks, and it's just a couple of questions about what they want to accomplish, what their mission is, and what the need in the community is for their services. And we do this in order to make sure that their mission aligns with our mission, vision, and values. We want to work with partner organizations that are working with children the same way we are. So we go through these letter of intents, and we find the organizations that we would like to see more information about, and we will send them an invitation to apply. This is actually happening right now. So it's a very busy season for Allison and I and Keith and our grants committee on the board. They're about to really rev up and have to start reading quite a few applications. So we have our invites go out. They are given until the end of February to turn those in. All of this is done electronically, submitted through our Foundant portal. And then March through May, we have a very intense evaluation program. And our board members are constantly meeting, they're discussing, they're evaluating, and then we have organizations that will present. We used to do it in person. I feel like this year it will be virtual, but we will have the organizations present what their funds would be used for and what impact that will make in the community. So if our board members have any questions, we want to learn more about them, or they are just generally new to Kosair Charities, we want to hear more about what they do from them. It's always better to have a conversation and to just an open-ended talk rather than read it on paper. So we love having them come and present what they are asking for. During this time, we will meet with all the committees, and we will go through and we will decide who we are going to be able to fund that year. And as Keith said earlier, we have about 180 applications for over 30 million every year. And there's no way at this moment that we can even come close to helping everybody that we want to help. So it is so hard and so competitive, but we are able to fund about 30 to 40% of those applications for anywhere from 12 to 15 million every year. So it's very hard for the board to go through and decide who is going to get the funding, but we do it every single year, and that is done in June. They then take those recommendations for funding to the board for the board meeting for approval. So there are a lot of steps from the beginning of the application process to when we actually approve funds that our board members, Allison, Keith, and I go through to make sure we are choosing the best organizations to fund for the most impact. Our payments are released in October. And then at the end of every cycle for payments and the grant cycle, our organizations that we have funded will turn in an evaluation. And they give us all different sorts of data, ranging from the number of kids they've helped to a success story, to the impact they had in the community, to the zip codes that they were able to reach, what their key goals were, what they want to do in the future. We asked them, you know, kind of what were the barriers or what issues did you encounter during this, and how can we help in the future with those things. We want to know absolutely everything that happened during that year and what we can do in the future for them to make it more impactful, make the program better, help more kids. What can we do? So at the end of the year, we go through all these evaluations and get to see pictures and stories and talk to these organizations, which is also another wonderful thing about this job and what Kosair gets to do. And a lot of times we get to cry with them, and you know, everybody's so excited to share their successes, and they want to share what they were able to discover and what new things worked and what they want other organizations to know works. So it's great to just kind of have that constant contact all year long with these organizations. And then at the end of the year, bring it all together and get to see a full evaluation of everything that happened during this time. So that's a long way of saying this is our process for our applications now, and everything is electronic. And we spend a lot of time, a lot of effort, and just a lot of heart and going through these and seeing who we are able to fund every year. I'll let Allison talk about the improvements we've made to the process over the last few years.
Sure. So earlier, Megan mentioned that one of the beautiful things about Kosair Charities is we have the flexibility to pivot with whatever the need is in the community. And one of the other things that we're able to do is constantly improve and enhance this application process. So some changes that have been made recently is within the last few years, we've created an online application. We have different committees in our board of directors within the grants committee to look at each particular area. So that was the education, healthcare research, advocacy, and social services. And so we're able to divide those groups up and look at those applications separately before coming together. As Megan mentioned, we've created the letter of intent process this year, and we're always working to enhance our annual reporting process. And we make these changes for a variety of reasons. One is to make sure that the the data and the resources and what we are showing the community and to donors are impactful and meaningful to you. But we're also always looking to make this process better for the applicants, because we know that the organizations that we support are working incredibly hard and doing very important work. So we want to make sure that the process is beneficial to them, and that the data they're collecting is not only beneficial for us to show our impact, but for them as well. But I do have a quick question for the group. If you want to look at the chat box, the question is, and hopefully one of our people can type it in as I write it in case, or as I read it, in case you missed something. But the question is, what data do you look for when you're making a gift? And what facts or figures help you decide where you can make a large impact? So when you're looking to make a gift, what kind of impact are you looking for, and what kind of data really speaks to you? And we'll look at, the question is in the chat box. If anybody would like to
Great question.
Who
Yes,
administrative costs of the organization? Are you looking at the administrative costs of where you're donating, I assume? So that could be potentially our administrative costs.
You know, that's an interesting question. There's a couple of interesting questions that have come up here. And one is, and I'll get to the administrative costs, I'll lead into it, is how has COVID affected giving this year? In effect, it's greatly affected it. If you look, the goal of any fundraising organization is to make sure that it raises enough money to service its need, and to always try to raise more this year than you did last year. And it had a wild effect on us. We were just almost even with last year, which is not where you want to be. But what we saw is it has created a lot of clutter. The donors are really have a lot coming at them, and they're having a real challenge in figuring out, what's the best way to use their money. And then leading into administrative costs, that's something that the not-for-profit world has been held accountable for a lot of times. And I think the better question is what is the responsibility of your administration in the process? Because it's hard to have a program without people. So you need to be making sure that you can fund your people adequately and keep them employed and keep them in your organization in order to deliver the program. Now, it can get out of whack. It can get out of whack. But I think the question is of the what's the impact of the programmatic money that you are spending. But that's a great question. That is a great question. And then another question that was in the Q&A was, do the children know that Kosair Charities is providing this support? And, they can never know enough, but we think that we certainly let the organizations know. And we have great partners, and I know that our partners will also share with the families where a large part of their support comes from. And it's not unusual for Kosair Charity to be the major donor to most of the organizations we support.
I'm going to pull one more question from the Q&A before we go on. This was a great question, asking if there's a different grants process for organizations that are looking to receive funding for current programs versus looking to create new programs for unique needs. And is there an emphasis or an incentive for organizations creating new solutions for old challenging problems? And that's an excellent question. And that is something, so the grants process is the same for new and old programs or new and returning programs. However, we do ask the question if it is new. And we always, in the application, organizations usually highlight ways that they are enhancing the program that might be a returning program or how they're improving upon it. And that's also a question that they answer in the annual report where they look at challenges from that year and how they plan to overcome those challenges, and look at sustainability long term. And additionally, we ask about how they're working, how organizations, what kind of partnerships they have with one another and with other organizations in the regions, to face larger issues than simply maybe the one program that we're particularly funding. But that's a great question. So we want to go on to.
And you know, Allison, the other thing, and I'd be really remiss and if I didn't talk about this for, and we've mentioned the board. Of course, we've explained how active we are, but our board, and there's really two parts of our organization that are really involved in this process. The first is the board of directors of Kosair Charities. It's a group of people that come to us wanting to make a difference in as many kids' lives as they can. And they are hands-on and they are very focused, and they spend a lot of time with us. But the other group is a community focused group. It's our advisory council. And these folks are just outstanding in what they do. And their charge is they go out and look for organizations that may be startup in nature. They may be small and aren't sophisticated enough yet to go through the grants process with the board. And they're looking for that organization that's at the grassroots level that's really making a difference in their area of the community. And you know, both of those groups are about 25-ish people big. We'd like to see the advisory board grow and have more tentacles out there into the community. But both of those, and they're all volunteers. They are all volunteers, and it's just amazing the commitment that they have to the children of our community.
That's a great point.
Yes. Allison, talk about our Boys and Girls Club. Here's just an example of one of the organizations that we have supported through the COVID pandemic and then for previous years.
Yes, absolutely. So one example of an organization that has made it through our grants process before all of the changes and amongst our new modern way of doing things is the Boys and Girls Club of Kentuckiana. We're a longtime supporter of their programs, and they're, just as we are pivoting to meet the need in the community, so are so many of these organizations like the Boys and Girls Club, which has really stepped up to serve kids, especially during this time of COVID, and being an NTI site to help kids make sure that they can stay connected with school and learning and have that outlet during this time when everybody's staying so isolated most of the time.
Okay, I think we have our next slide. We're just talk a little bit about what we are trying to impact and what we need your help doing. So here's a poll question that we have for you all to answer. Again, we'll take about 30 seconds and have you all share with us your answers. Maybe it'll pop up. There. We want to connect you to your goals in ways that are meaningful to you. And then what do your goals look like? And you can choose as many as you'd like to on this. These are all things that we work with, all areas that we are involved in. And we just want to see kind of what the community would like to see. So take a little while and figure out what you think that your goals will be for your funding, and we'll go through these.
Of course, you can choose as many as you want. It's hard to narrow down some of these because they all seem so important, which is why we are so focused on all of these different areas. I think we will give you one more minute to put in your answers. Well, there we go. It seems like they're all pretty much on point with ensuring that children have access to the care and resources they need as being one of the things that is most meaningful to you. But there's not an area that doesn't seem important to this group, and that's great.
We
We'll
love
dive
that.
into how we're addressing all of these needs.
Yes, we love the creating a world where kids can just focus on being kids. That is one of the hardest things we see when kids can't just be kids any longer. So,
You know, as that slide poll question said, you know, our job is to connect you to Kosair Charities that are in ways that are meaningful for you. Our job is to help you achieve your philanthropic goals and focus on what you want to achieve. It's because it's not about us. It's about you achieving your philanthropic needs. And a lot of times, you know, we think about our retirement plans, and we think about our health insurance plans, and we think about, you know, how we're going to drive to work, but very rarely do we think about our philanthropic plans. So, and it's one of those things that if you could sit down and dream about what you want to accomplish with your philanthropy. And I come from a world where everybody's a philanthropist. I don't care if you have $100 or $100 million, you can be a philanthropist, because if you have a dream on what you want to accomplish, then we can help you get there. We can help you get there. And as we saw in that poll question, you know, you're really focused. And this is just another example of a slide that I went over earlier. But, you know, if you care about any of these areas, we can help you get there, because we work with the organizations. We're talking to these groups every day, and we have a good feel for who's really making a difference in the community. But I really want to talk about the last one, and that's no surprise to anybody, and that's abuse and neglect. You know, I mentioned earlier that, and I grew up when polio was in our community, in our country, in our world, and I just remember the fear that was there. And fortunately, you know, through research and everything, it's pretty much gone. There's a few pockets in the world, but it's pretty much gone. And but it had lifelong, for those affected with polio, it had lifelong issues. It's created lifelong issues. And I don't want to take anything away from polio, because it's serious. It was serious. But abuse and neglect, I feel, is today's polio. We lead the country in the incidence. We are twice the national average. And if you think about it as a human tragedy issue, it's horrible what these kids are going through. But also, if you think about it as a development issue or even an economic issue, that we know that a child that's abused will spend $3 to $4 million more dollars in their lifetime on their health care than a kid that's not. We know that you know, there's these children very rarely achieve their full potential. So, you know, the cost of their maintenance throughout their life falls on others. So this is just a tragedy issue, but it's also one that we can fix. Much like polio, we can end this, but we have to do it together. And Kosair has made a goal of ending it by 2023. We've got our work cut out for us. Chances are we're not going to make that goal, but it's not going to be because we're not trying, and we're always going to be focused on trying to end it. So again, when you think about your philanthropic plan, think about how we can help you achieve that goal. So now I guess we're ready for questions and answers, and I think I've seen one. So
yeah, we've got some great questions coming in. Let's see, let's give the first one. does a recent grant stand out as particularly impactful?
Well, I think we all can answer that one, but I'm almost, for me, it's what day is it? Because when today I might see the Home of Innocence, or I might see VOA or someone, and I'm just going, God, we really made a difference here. And then tomorrow, I'll go to Sowing Seeds with Faith or the Dare to Care or something, and it's like, man, this is a great grant. Boy, we've really made a difference here. I think that's the neatest thing about Kosair Charities, is that we're involved with so many great organizations. It's hard to say there's just one. When I go down to see Dr. Bierman and cry a little bit, when I see what's going on with those kids, I say, man, that's a great grant. We did it. We got it right. Or then if I go over to the University of Kentucky with how they're embracing the mission of ending child abuse, and have really opened up the power of the University of Kentucky along with U of L statewide to end this. I'm going, well, we got it right. But it's just hard to say that there's one that stands out, because there's so many. There is so many. And I think that's a great thing about Kentucky and Southern Indiana is that we work together so well in trying to achieve those. Megan?
Well, say one that stands out for me, just because it was such a leap for us, and it's just a testament to how we are improving and how we are expanding, is Pikeville Hospital. And we had their application come in, and if they had a child, if the baby was born that needed any sort of NICU services or any sort of ICU issues, they could not be in that Pikeville Hospital. There was nothing near. There was no medical centers near them that were able to handle any of that situation. So they would have to drive in an ambulance 1.5 hours, 2 hours to the closest area and leave their family. And we were able to start funding this hospital so they're able to catch up with the surrounding areas. We have bought them warming beds. We bought them equipment. They are now working on a NICU wing at their hospital, so people that are in the area do not have to leave. And that is so exciting. And the population around there is so grateful and so excited to see that they can stay with their families. And that is, we had never ventured that far in our funding, and we have decided, we're going to take a leap on this and see what happens. And it has just been absolutely wonderful. And they keep in constant contact with us and always let us know what's going on there. And we get to see pictures, and it's just been great to realize that you can make a difference, such a big difference in people's lives with one grant. And that one grant was able to keep those families together while they have just had a newborn baby. And that's the most important thing, that you want to be with your baby. And we were able to help do that. So that's one that has stood up for me recently, just because it was so different than what we have been doing in the past.
Megan, before Allison answers or asks the next question or even gives an answer, you talk about that. And then I remember the grant that we made over at Floyd Memorial Hospital or something, something similar. They needed some specialized equipment for helping babies that were born with neonatal abstinence syndrome. And that's yes. Babies that are born, addicted to some substance. And the difference that it's made in those little bitty babies that are just in so much pain. So, but there again, it's another day, and it's like, oh, we got this one right too. So yes. Just really, really kind of neat.
Yeah. And those babies had to come across the bridge to Louisville. And while that isn't as far as of a travel, that's still taking the baby from the family. And that's we want to prevent. We want them to stay together. So yes, it was very similar, very close to us.
Mm-hmm. Absolutely. This is my first grant cycle, having the privilege of working here at Kosair. And so I haven't been able to make a lot of visits and see the impact as much, but I know that reading through the grant applications, there's no such thing as a bad application. So it's truly, our board has their work cut out for them when they're trying to narrow down where to put this funding. The need is so big. And while we give a significant amount of money into the community, it's just so hard to meet all of that need. So that's, I just was blown away by the number of incredible programs taking place all across the state. and in Southern Indiana. So before we go on to the next question for us, we actually have a question for you. You can type your answer in the chat box. So we fund a lot of programs that provide community resources. So we were wondering, growing up or now, do you or has your family benefited from community resources, and which ones? And if you want to type your answer in the chat of impactful community resources for you.
And we work with all sorts of different organizations with community resources. We fund some of the ministries for infant supplies, for diapers, wipes, creams, anything that they need for their infants. We help with the food, Dare to Care, Kentucky Harvest. We want to make sure that children have food on the weekends, and they have fresh food, so it's not just the donations that are in the box. A lot, as we said, wraparound services. We do Christmas drive or clothing drives at Christmas. So they have coats, they have winter wear. We want to make sure that the kids are, healthy, and they have the resources they need in our social services. And we work with a lot of organizations that provide those for the kids and make sure that everybody is able.
Mm-hmm. And some of the answers that are coming in are Dare to Care, Boys and Girls Club, Cabbage Patch, Autism Center, Boy Scouts, Louisville Central Community Center, and the Kosair Kids Financial Program, which there will be another town hall in April that I'll dive into talking all about that. So if you are interested, please tune in for more information there. The libraries, an important resource to the community. So these community resources benefit so many people, us included, and so it's so wonderful to be involved with them. So we have a few more minutes, so we'll ask a couple more questions. One quick question is that asking, looks like we're gonna have a poll question. Well, one more question for you. Looking at some of the biggest barriers that prevent Kentuckiana kids from thriving. In your opinion, what do you see as being one of the biggest barriers to kids being able to live their lives healthy and safe?
And Allison, while they're doing that, I'll just address a couple things. Is earlier, Megan and Allison both said that there's more need out there than there is money. And when you think about Kosair Charities as being the largest funder of kids' issues in the state and maybe even the country, it's real concerning that there's just not enough to go around. And Kentucky has a lot of issues and that we're focused on. So there's that. Mm-hmm. Then as we look here, access to housing, hunger, safety, and basic other necessities. Yep.
Yeah, absolutely. And these are all
absolutely.
These are all barriers that the programs that Kosair Charities funds and that prospective donor funds would be going to try to overcome those barriers. So we can take probably a couple more questions.
Well, we had a question come up earlier on the chat that spoke about how we decide if we endow or not. We're pretty unique in that by charter, every gift that we receive is endowed unless the donor wants it to be used for a specific purpose immediately. So if somebody sends in $100 and says, or 100,000 and says, do good things, that gift is going to be endowed and will help, solve issues forever. If the donor says, here's my gift and I want you to put it in Pediatric Research, then that's where it would go. So we have a lot of flexibility in to do that. But it's usually a partnership and a discussion between us and the donor.
Yes, and if you would like to have a discussion like that and you want to talk kind of more about what your goals are and where you would like to see your funds go, our wonderful coworkers, Taylor Davis and Allison Samblanet, are here to answer all of your questions, to sit with you, to just kind of talk about what you'd like to see happen in our community across the state, Southern Indiana. So if you just want to raise your hand in the box or send them a quick message, they will get your information and contact you after this at a later date. We would love to have conversations with you all and see how you feel about what we're doing and how you'd like to help. And I think that's what we have for you all today. Thank you so much for spending this last hour with us, learning more about what we're doing here at Kosair, what we're trying to accomplish, and all the impact that our partner organizations are making in our community across the state. It is absolutely wonderful to be able to witness everything that is happening here.
And I feel like this presentation has simply created more opportunity for questions. And so we would love to engage with you. If you had a question today that we weren't able to reach, all of our contact information is on our website, and we would be happy to talk with you. And again, if you just hit the raise hand button at the bottom, some of our coworkers will be making note of who you are and will be reaching out to you and that can be for questions, getting you connected, or to talk about how your contributions to Kosair can be most beneficial and most impactful to you and to the community.
Well, and I want to thank a lot of people. I want to thank Megan and Allison. I want to thank our entire staff for the hard work that they do, because again, Jim Valvano used to say every day you should think, laugh, and have your emotions move to tears. And at Kosair Charities, we do that by about 9 o'clock in the morning. So it's wonderful staff. I want to thank our boards, not only our board of directors, but our advisory board for the leadership that they give us every day. And I want to thank our agencies for all they do to help our children. And most importantly, I want to thank the donors that make it all possible. Because without you, Kosair Charities can't exist. And without Kosair Charities, many of these organizations couldn't exist. And if not for Kosair Charities, who? So thank you.
Thank you so much. And everybody stay safe.
We look forward to hearing from you all.
Thanks.